And some of the, letters of this bill has been said, we take care of some of those things. Mr. Adigun talked about the tax reform thing in Lagos. Some said Lagos is paying too many tax, but some of them are complaining. But with what we have now, Mr. Aja, and the spirit of this, just like in law, there are intent, there are purpose, there are spirit to the law. With what you have seen so far through these proposals in these bills, do you think it is the right way to go? And those just shouting, respectfully speaking, and making controversies about this is because they do not understand. Do you think it's the right way to go as an economist and as a Nigerian?
Yeah, I think the bill is well written. There is no perfect bill, but if you had to say good and bad point, it's like comparing 9 good points and 1 bad point. The only controversy in 4 bills, nearly 500 plus pages, is the VAT derivation. Nobody has talked about any other thing apart from VAT derivation. So that's a plus on the bill, that every other thing is okay apart from that one issue. So if that's the issue and they want to horse on that, perfect. But the bill is a very good bill. Lots of exemptions, lots of deductions, lots of simplifications. We can't just say no because of just VAT derivation. Doesn't make any sense.
All right. Thank you very much. I'll be speaking with economist, financial expert, and public affairs analyst, Mr. Isiaka Adigun. Thank you very much, sir, for your time and take this morning.
Thank you for having me. Do have a pleasant day.
All right. And of course,
appreciate that.
Thank you, Mr. Aja. Do have a lovely day as well. All right. That will be the size of the program. As we say on this program, the size of this particular conversation, the first one, before we switch gears, is about information. It's about education. It's about things that has to do with the well-being, of the people. In as much people are talking about it, trust us to look into it as well. And I'm sure you have one thing or another, you have understood better on what we are saying. It's an ongoing conversation because the bill has been, forwarded to the committee. The committee at the National Assembly will now put it off for public debate. And I want to believe you, that you're looking at me, will be part of that conversation when the time is right. After this quick break, when we come back, there is an elephant in the room, or so. There was, maybe there is, or maybe there was. The topic, 10 years ago, 20 years ago, when you talk about HIV/AIDS, people shrivel, people quiver. They are very careful. But now the conversation seems to have gone down, and many persons are thinking otherwise. Is that true? Take this quick break. When we return, we talk about HIV/AIDS. A serious conversation. Stay with me. All right, thank you for staying with me. I said something earlier before the break that 10 years, 20 years ago, 25, when you talk about HIV/AIDS, people want to listen. They are careful. Public advocacy was all over. I remember so many radio drama. Abule Oloke Mary was one. I'm not sure if that's the name, but there used to be a play like that in which conversation like these arise and all of these things, and all of a sudden, not just all of a sudden, gradually the conversation went down. And many persons will even ask, is there anything like HIV? Is there anything like AIDS? Maybe, since after that, we've had, Lassa fever, we've had the 2020 pandemic, and many of those things. Ebola have come and gone, and many other things have come. So maybe that is the reason why the topic of the HIV/AIDS, the scourge, has been played down to think maybe there is nothing like that again. But yesterday, was the World AIDS Day 2024. It is celebrated, 1st of December, or it is commemorated rather, because I'm not sure if there's anything to be celebrated in HIV and AIDS, commemorated World AIDS Day, and that was yesterday. So we're having the conversation this morning, and the theme for yesterday, we'll look into that as well. And it's HIV.gov, the United Nations, many agencies as well This morning we have with us a youth advocate and the executive president of the Ghana Youth Development Foundation. I remember the foundation of it. He's there and he has been here severally, to talk about other things. But then in this matter, talking about what AIDS Day was celebrated yesterday, Mr. Tunde Omole. Thank you for coming.
It's my pleasure to be here.
Very well, quick one, because of time. Yesterday, the thing was take the right part. You have it on your screen. My health, am I right? I posted a poll. Does HIV/A and AIDS still exist? Let me start from there.
Yeah,
because it's been long we talk about.
Good morning, viewers at home.
Yeah.
And my name is Tunde Omole, like you rightly said. And aside being the executive director of Ghana Youth Development, I'm the state coordinator for civil society for HIV and AIDS. That's the umbrella body for all the NGOs, faith-based organizations, CBOs, working to see to the end of HIV and AIDS in Nigeria.
Right.
So I'm the state coordinator for Osun State.
Right, let's go.
Now, definitely, we still have HIV/AIDS among us. Over the time, I believe strongly that there was a change in our advocacy strategy. Way back then, when you see someone that is HIV positive, anybody you see that is leaning, looks like caricature of their old self, you say, shooting HIV is me, and stuff like that. Then I think over the time, during the course of programming and intervention, the advocacy change, the information change, that you can actually live healthy with HIV because there are some new inventions, medical invention, and so many other things like that. So back to your question, I still believe strongly that we all see this. I see there was a NIAIDS, which is National HIV/AIDS Survey, that was conducted in 2018, and that was a statewide. We have never done anything of such in Africa. And that actually gave us a reflection of why we still have HIV/AIDS, and then I think the prevalence in Nigeria. I think we're having close to 2 point something generally. If you compare
2.7 what? 1,000?
No, 2%
okay
of the total population. If you look critically,
Nigerian population.
Yes.
2.something%.
Yes. If you look at Osun State, we are 0.9. And if you extrapolate the population of Osun State, and as regards to 2006 national population census, you realize that 0.9, we are about, if you extrapolate now,
that's almost 1%.
We're almost 1%, and we're about 5 million now in Osun State.
You talk about
so
in the region of
400,000 people.
Okay. 50,000, yeah.
So in Osun State now, we have about 30,000 people that have got tested, and
confirmed.
Yes, confirmed. They have been placed on treatment so far, and out of that 50%, we are still looking for about 17,000 people that we need to know their status, and they can be placed on treatment immediately.
Why are you looking for them? Is there a reason why you should look
because
for them? Is there a projection?
If you are not affected, you are not infected directly, then definitely you are affected one way or the other.
Oh, okay.
In as much that we still have new infection, we still have people walking the streets that they are HIV positive and they have not really known. There's no way you can get them treated. There's no way they can get to zero prevalence. There's no way that they won't be able to transmit so the more they walk on our streets, in our society, in our community, the more we are putting other people at risk.
At risk, okay. Quick one. Let me ask you, from the place of advocacy, I think before, like 10, 15 years ago, I used to know one or two radio drama that, we talk about community, HIV/AIDS, some of these things. And gradually, the conversation went down. Is it because the scourge went down, or the strategy of abstinence, of antiretroviral drugs, or some of those scientific intervention was working, and the numbers were reducing, or it was because other scourges, Ebola, Lassa fever, what's it called, COVID-19, came up and, pushed the conversation to the side? Or is because your intervention and advocacy were working and the numbers were dropping, or it's just a shift in focus?
All right. Oh, that's a lot of questions. Anyway, and let's look at it from this angle. First and foremost, and I think way back then, the governments at every level, they were actually putting resources, trying to create high-level awareness, trying to make sure that everybody, they are aware of their HIV status, they know they get tested. But over the time, we realized that And most of the projects on HIV and AIDS intervention are being sponsored by development partners. And he who pay the piper dictate the tune. So at some point, their focus is technically our focus. If they tell you that they really want to take care, they are bringing their
If the
millions.
states are not sponsoring, sorry to butt in, or they are not really as big as they were before, maybe they felt there is no reason to do that. The threat is no more there.
Oh, no.
Do you see it from that angle?
No, I'm not seeing it from that angle. I just felt
because they might feel, why do we have to spend so much if the numbers are going down?
No.
Was there any time that the numbers really went down in the nation?
Yes. Even as at now, way back then, Ocean used to be like 2.0. Ocean used to be like 2 points. At some point, we were 1.4. At some point, we were 2.9. But at some point...
Are we talking in millions or in percentage?
No, we are talking in percentage.
Okay. Of the population?
Of the population.
So that people know what
So at some point now, it's now 0.9.
Okay.
It shows that to some reasonable extent, the intervention in the past have really done a very good job. But one thing about HIV, if you just wait for just a week or a month, and you are not doing anything about those people that are still outside that are yet to know their status, then there's every tendency that it can boomerang and can be counterproductive. So, like referring to the question you asked the other time, funding has not really been there. Then most of the development partners, they are focusing more on treatment because there's a prevention is a treatment. If you get treated and the HIV, though it does not have cure, but it gets to a level where the
till now
HIV
it doesn't have cure.
Up to now, we don't have any cure for HIV. But you can, if you adhere strictly to your medication.
But there have been different attempts, different tries, different claims.
Yes.
To say, oh, I have these, come to me. Sometimes in alternative medicine and some of these things. But scientifically, as of 2024, there is no cure. That's what you say.
No, there is no cure now. But even though
for
we
AIDS.
are aware, yes, even though we are aware that there is a vaccine going on, that they are going through the trial stage, but we have not really seen the results. Then most of the
that's vaccine.
Yes,
for prevention.
For prevention. Up to now, we still even have what we call pre-exposure prophylaxis. It's like a medication you will take if you know that you are vulnerable to being infected with HIV. You can take that, which will boost your immune system against being infected with HIV and AIDS. We call it PEP. Then aside the conventional ABC, abstinence, be faithful, condom, prevention of mother-to-child transmission, and some other things. So you can take that tablet at some points, then you can boost your immune system if you know you are actually, especially for health workers, for some people that get involved in heterosexual or maybe homosexual sexual intercourse.
Let's take it back a bit. The symptoms, we know, don't be exposed to sharp objects.
What
I mean, how you can get it, to transmit and so all of these things. Are these still the same way, being sexually reckless and all of those things? Are those things still what it is right now, or there has been change?
No, definitely they are still. It's all about an exchange of body fluid.
Okay.
It's all about exchange of body fluid. So if someone is using sharp objects, you are sharing with somebody that is infected and it's not sterilized, there's every tendency you can get it. If mother is HIV positive and is not on treatment, there's every tendency that she might be able to transmit the HIV to the unborn baby. If someone is having unprotected sexual intercourse, there is every tendency that someone can be infected. So it's still all about the exchange of blood, or if you are transfused in a quack place or in a place that is not really maybe standardized, maybe the kind of body fluid you are being transfused, there's every tendency that you can be HIV.
All right. Now, let me ask you this, because it's a conversation that we don't get to have every day for the last 5-10 years, almost on every platform, except maybe for, advocates like yourself. Is it still as deadly as before?
That's very dicey. It's not as deadly as before in the sense that way back then, people used to call it arunko.
Yes, that's the Yoruba interpretation.
Now, otigbogun, you can actually use medication in as much that you get tested early enough and you know your HIV status. Immediately they are starting you up with your antiretroviral drugs. And there is something we call viral suppression. If you take those medications holistically, if they get you tested, there's every tendency that they won't see the virus in you. They are going to be rather inactive. Even you can have heterosexual sexual intercourse without transmitting it to your partner, because we call that in viral suppression. And you know, there's a global goal now that you are saying that they call it 95, 95, 95. 95 is that 95 by 2030, and 95% of people living with HIV must know their status. 95% of those people that have known their status, they must be placed on treatment. And 95% of those people that have been placed on treatment, they must have experienced viral suppression. That means the detection of the virus in their body system is going to be zero. Mind you, it's not as if maybe the virus will go away, it's as if they are hibernating. As soon as you are not taking your medication again and you are not adhering strictly, then they come back with full force. So that's why we keep telling people that in as much that you know that you are HIV positive, then you commence. And thank God in our state we have different development partners that are working with us. And most of our healthcare facilities, especially secondary selected one across board and tertiary health facility, they are providing services, they are providing care and support for people living with HIV for free. So all those things in Ashubiaro, in Union Osun Teaching Hospital, in OAU Teaching Hospital, you get your medication for free. All you just need to do, get tested. If you are positive, you are placed on this medication. And so back to your question, it's not as deadly as it used to be if you take proactive steps.
Now, the World AIDS Day 2024, the theme, just what we have says, take the rights path, my health, my right.
Yes.
Why? What's this connoting? Why this theme for this year?
Yeah, if you look at it critically now, you realize that over the time you still look at people, they are still discriminating against people living with HIV and AIDS. They are stigmatizing them. And most of the times, people tend to really take some decision that is going to be inimical to the growth or to ensure that we stem the tide of HIV and nip it in the bud. So what we are saying is that everybody should take the right path, which is know your status, know what you really want to do, know everything about yourself as regards your HIV status. So at the end of the day, you can walk up there and get tested. Even there is an invention of self-testing. If you really don't want people to stigmatize you or say anything that might not want you to get tested, you can get test kits. There are instructions there. You do it behind closed door. And if you get positive, then you can actually go to access any treatments at all the service center.
Those kits home test kit that you talked about, is it as reliable as what obtains in the hospital?
Very, very reliable. Very, very reliable. The only thing that one is taken away from is because people still get scared of actually going for tests because the impression.
Let's speak to that.
Why? Because where it was coming from, the way they sold HIV and AIDS, and you can't blame the people that sold it, because at that point in time there was no known cure. People were just treating opportunistic infection, and by the time you get to the level of opportunistic infection, it's already showing AIDS, and most of the time there's every tendency that people die. So they have not discovered that there is. Over the time, there is advancement in medical science. Right. Way back there, in last 10 years, they take almost like 10 drugs in a day. Now it's just one tablet. You take it. And when people talk about HIV and AIDS, and you compare it to hypertension, you compare it to diabetes that kill, even malaria kills faster than HIV and AIDS these days. Only if you don't know your HIV status. And the window period, if someone gets infected today, before you can manifest to HIV, to AIDS, it's going to take about 8 to 10 years. So that gave the window and the leeway for you to actually get tested, know your status, then you put yourself on medication.
For clarity, HIV is the virus. AIDS is the sickness,
it's
right?
Disease, yeah.
Now, let's talk about prevalence in Osun State. Is there a reason to be worried? Or everything is under control?
Definitely, we have reasons to be worried.
Why?
One of the key things that we have, you said you noticed that over the time there has not been awareness creation.
Yeah,
when you
that's
talk
really
to
gone low.
People think that is HIV still existing? Why are you talking about HIV at this point in time?
Or you are wishing them bad.
Meanwhile, considering what we have discussed this while we were here at some point, talking about drug abuse and so many other things. This made young people to practice in a very reckless sexual behaviors, and this make them much more vulnerable to being infected with HIV and AIDS. So we really need to be concerned. Then 17,000 people, or about 17 to 15,000 people, are still working as according to the statistic research, well-detailed study that people that are living with HIV are still working on us. So we need to be what? So if we can intensify efforts, create high-level awareness, and tell people that they should go out there and get tested. When they get tested, there's a free medication for them, free care for them, free everything for them.
In government hospitals?
Yes, in government hospitals. And there are a couple of private hospitals too, which I wouldn't want to mention.
Yeah.
Now,
the conversation and the intervention from your end, you have an organization you're working with personally. You have the one that you are heading, as a leader. Are you speaking to the Ministry of Health in the state? What are they saying? Are they as concerned as you are?
All of us are concerned, but when you are concerned and you don't have the resources at your beck and call, there is little or nothing you can do. That's why we have been trying an effort. Thank God, one of these media advocacy that we are doing now, you didn't collect a dime from us. And I'm pretty sure we are reaching a whole lot of people through this thing. So that's our own way of contributing our own quota. They are concerned, and there's an agency that's actually saddled with the responsibility of Osun State Agency for the Control of AIDS, Osaka.
Okay, because I know there used to be NACA at the federal level.
We used to have Osaka too, and we have Osaka in Osun State. And now
is it still functional?
Yes, very functional. We're having a rally today. We have started working because we work with them as a civil society organization. We started a 4-day-long activities. We had a tennis competition just to create awareness, using sport to create awareness on HIV on Friday, on Saturday. Then yesterday we had candle nights. We walked from their office in Odelowo to Oshomole. And the essence of doing that
that's sounding more like adverts now.
Okay, sorry.
So let's speak to the substance of the matter.
So
all right. I understand. Now, for a newbie, let me put it, for a Gen Z guy who's listening to you this morning, you're talking about AIDS, possibly in their whole lifetime. That has not really been an issue. Can you enlighten to say, this is what we are talking about? This is how it's transmitted. These are the symptoms for the purpose of those that are not in that particular scope years back. Listening to you, watching you.
Critically, what we tell them now, these days now, sex is getting so transactional, and people really want to have the best of time. They don't care. And, most of the sex now, they are with drugs use, which I know is common with the Gen Z than the younger people. And those two habits, those two lifestyle actually make them much more vulnerable to be infected with HIV and AIDS. So if by venture they want to get involved in their sexual intercourse, which we are not encouraging, at least they should protect themselves, which is the use of condom. We have both male and female condoms. And when they should desist from using drugs, some of them they get, because one of the key population, those people that have high risk, are those people who inject drugs. They share most of this needle. So if someone is affected and you share the needle with that person, directly that thing is going to the bloodstream. It has highest level of potency to get you infected than even regular heterosexual intercourse. Then, because I told you earlier that one of the, way back then, 80% of the new transmission, because there's something we call recency test. If you get HIV today, they want to know when you get tested. There's advancements in technology that is doing that. So they will know the actual time you got infected. So what they do is that the heterosexual intercourse is becoming so transactional now. And people will want to, according to study and observation with young people, they prefer doing it skin to skin, so to say, than using condom. So we encourage them to be using condom. We encourage them to desist from using drugs.
Are you still practicing, are you still preaching abstinence?
We do, especially for under 18. You can't go to any schools and talk about condom. We don't do that. But the reality with us is that most of these kids, they are actually sexually active. So we have a lot of challenges.
So you have to manage
because there's
a
policy that you don't talk to underage about condoms. At the same time, most of them are sexually even active than their parents.
So you have to find a balance.
So
let's speak to the symptoms.
When someone, like I told us earlier, that I said, if you are HIV positive,
because you are more or less like an ambassador. So speak to the issue.
The symptoms might not really come until after 8 years of your first infection. And one of the key things
8 years?
Notice, 8 to 10 years. That's when the symptoms can come. That's why we tell them
it will have gone full circle
by then. So, and at that time, it will have become a full-blown AIDS by the time you send them. So the management can be very, very extremely difficult. And one of the key things, you'll be feeling, even in DSC, you'll be sweating. At times, you realize that your muscles are wasting. That your muscle used to be firm, and you realize that it's wasting your skin color. Then you can have all those rashes that won't go, diarrhea, vomiting consistently for like maybe a couple of months, because AIDS is not really a particular disease. It's like a
acquired immune deficiency syndrome.
It's a syndrome. It's a combination, because they know that the body system is actually very weak now. So we call some things opportunistic infection. They know that the immune system, the white blood cell, the T lymphocyte.
So that's what the HIV does to the body, destroying the immunity.
Destroying the immunity.
So whatever comes into the body after,
creeping.
Yes,
so
wipes
the body will be so weak to fight back. So that's what we call syndrome. So it's a combination. But one of the key things is that cough. You can be coughing for like 3 months. Some people can be coughing for like 3 months non-stop. You are a suspect.
And they will think it's TB.
It can be TB too, because
that will have come into the system.
Because
immunity is down.
It's an opportunistic infection. When TB realizes that this guy's immunity is down, let me creep in.
I'll take your part in short, 15 seconds. Look into the camera.
Okay.
Give the young people a sincere, elder brotherly kind of talk about this particular conversation.
Yeah. Okay. Thank you. And I really want to enjoy all our young people out there that the best way you can prevent yourself is to chase your dreams and stop abstain from an unprotected sexual intercourse, even abstain from sex if you are still chasing your dream. And in as much that you know that you are HIV positive, which I know it can be transmitted through unprotected sexual intercourse, through the injectables, through blood transfusions. But as young people, let's live reckless life. Let's be pious in the way we do.
Yeah, I know you're passing my message. How about the risk of people share babbing stuff, clipper, at Baba's house?
Not everybody can afford to buy a clipper, but you can always tell people that they should try to sterilize. And that sterilizing machine might not really be effective, because some of them might be faulty.
Yeah,
and they put all those
and they are just plugged there without working.
You think that is sterilized. Let them flame the clipper. Let them clean it with spirit. Let them flame it. After doing that, then they can use it for
How about the people that already have it? I want you to give them a message of hope.
The best way you can know that you are HIV positive for you to walk into any healthcare facility and get tested. Then when you get tested, then it's as good as you are having a malaria or slight headache. They give you all the necessary medication. The side effect is reduced now. You can live your life. It does not hold you down for anything. It's just like taking a tablet per day. Then you are living, if you know how much people living positively with HIV/AIDS in Osun State.
And you won't even know.
So, and you won't even know. They are plump, they are good looking, and they are fine. So please, let's abstain from sex. Let's use condom if the need be. Then let's desist from using drugs.
All right.
Those are those things that push young people to be affected.
Thank you very much. We have been speaking with Tunde Omole, the Executive President of the Ghana Youth Development Foundation, and of course, he wears many caps that has to do with speaking with the young people and then coordinating the affairs of the CSO, working, for the messaging of HIV and AIDS and prohibiting it, especially the advancement. Thank you very much for your time, and wish you and your organization all the best as well. That will be the size of the program today. We spoke to the controversial, tax reform bill 2024. We spoke with Kalu Aja and Isiaka Adigun. I gave their 2 cents on the matter, saying it's about education. Let's read that and then understand what we are doing. And of course, we just talked about the World AIDS Day 2024 that held yesterday. In whatever you do, please be productive. And, as I usually say, stay alive. You can have a quick, a recap of this program on our YouTube channel at Western Spring Television, and also on our various social media platforms on X, on Instagram, and on Facebook as well. Big shout out to the production team. Femi Ojo is my name. That's the first of the series for this week. God bless Nigeria.